This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Elixaban 2.5 tablet is an anticoagulant that helps manage blood clots. It is essential for patients recovering from surgeries or those with heart rhythm issues. Indications and uses. This medication is indicated for the management of blood clots formed in the veins of the legs and is used for preventing blood clots in patients with irregular heartbeats. It is also effective in preventing the formation of clots after hip or knee replacement surgeries, as well as managing recurrent blood clots in the legs or lungs. How it works. It works by blocking factor XA, a crucial component in the blood clotting process, thereby reducing the ability of blood to clot. Directions for use. Take this medication as prescribed by your healthcare provider. Swallow the tablet with a glass of water. If you experience difficulty swallowing, consult your doctor for alternative methods of administration. The appropriate dosage and duration will be determined based on your individual health profile, including age, body weight, and specific medical conditions. Possible side effects. Common side effects include bleeding from various body parts, bruising, anemia, low blood pressure, and nausea. It's important to contact your doctor if these symptoms worsen. Precautions and warnings. Before using this medication, inform your doctor about any existing conditions like liver, kidney, or heart diseases. It is not recommended for individuals with bleeding disorders or those who are pregnant or breastfeeding without prior consultation. FAQs. 1. Is this a blood thinner? Yes, it is an anticoagulant that prevents blood clot formation. 2. What precautions should I take? Inform your doctor about any pre-existing conditions. 3. What if I forget a dose? Take it as soon as you remember, but don't double up. 4. Can it cause low blood pressure? Yes, it can. Consult your doctor if this occurs. 5. Is it safe during pregnancy? It is not recommended due to unknown effects. Thank you for watching. If you have any questions or suggestions, feel free to leave a comment below.